We're gathered here today with heavy hearts because just recently we marked the fact that over 1 million Americans have died of COVID-19. When you think of a number of that size, it becomes very impersonal. But in that number includes my cousin Jerry, my cousin Mary, deacons that I ordained in Louisiana, preachers that I ordained in Louisiana, friends of mine, fellow pastors. It's not just a number. These are individuals. These are peoples. These are people whose lives have been cut short oftentimes because of COVID-19. I stand here today along with friends and supporters to urge our community to stay vigilant because COVID is real. A lot of cities, Philadelphia just yesterday has reinstated the mask mandate. We're all tired of COVID. We're sick and tired of COVID, but apparently COVID is not tired of us. And COVID is still real and it's still dangerous, and there are effects not just of what we know, but we're finding out every day other effects, long-term COVID. And so we're here not as just individuals, but as a coalition, joining forces together because we want to save lives.
We still must recognize COVID is here, and we must take the measures and go forward and continue to wash our hands, wear a mask, and continue to echo the message and really challenge those within our congregations to share the personal message with family, friends, and others. Many have heard many global messages from many others about masking up, about taking the vaccinations and booster shots, and there's still some hesitancy. Long COVID is existing and it's real. So we're asking you to take time to make a personal phone call, a personal text, a personal email, share your personal story, share your personal message.
Yeah.
That's where we are in this fight. It takes your personal influence to be able to share with others the importance of being safe and healthy.
The Mobile Public Health Education Unit is a tool that was designed by Community Partnerships for Public Health International, and it takes important public health messages into our communities with trusted voices, so that in those places where people are hard to reach and those places where trusted voices resonate more than the news media, we take this vehicle into our communities to share messages about how people can stay safe from COVID, how you can get vaccinated, and where you can get vaccinated. And we're delighted to be here at Shiloh Old Site to launch the Mobile Public Health Education Unit in Fredericksburg. The Safe and Healthy Communities Coalition of Virginia has deployed the Mobile Public Health Education Unit in a number of cities, including Richmond and Petersburg, and now we're here in Fredericksburg. And we're delighted to have our partners, so many members of our coalition represented here today to express the urgency of this moment. We already know that COVID can make you severely ill. We know that COVID can cause you to be hospitalized. We know that COVID, unfortunately, also leads to death. Some people may not yet be aware that if you test positive for COVID and you experience severe symptoms, you may also develop long COVID or post-COVID syndrome. And post-COVID syndrome is an additional nightmare on top of COVID infection. The symptoms of post-COVID syndrome run the gamut from neurological to cardiovascular, gastrointestinal, pulmonary, respiratory, so many things. People have anxiety, insomnia, muscle pain for months after they're infected with COVID. But what we know is that the best way to stem the tide of severe illness, to stem the tide of hospitalizations, death, and long COVID is to get vaccinated. And if you've been vaccinated, we urge everyone who's been vaccinated to get boosted. And if you've been vaccinated and boosted and it's been more than 6 months since you were boosted, we encourage you, especially if you're immunosuppressed or if you're over 50, to get a second dose, a second booster dose. Trusted voices are the voices that have the most impact in our communities. So we ask that those of us who are vaccinated, those of us who are boosted, those of us who have the love of God in us, that we would reach out and have the difficult conversation. Some people are afraid. Some people are afraid. They may be afraid of the vaccine. They may be afraid of needles. They may just be afraid of the pandemic and feel paralyzed and need someone to encourage them. Some people have had misinformation and disinformation impact their ability to make a decision. There are good reasons why people are skeptical, but let's deal with the facts. We've been in this pandemic for over 2 years now. We've had the vaccine for over a year now. As Dr. Dobine said, in this country alone, over 1 million people have died from coronavirus. Most of us know people who have been severely ill or died from coronavirus. Hardly anybody can come and stand before us today and say that they know someone who's died from getting vaccinated. Truth is, the vaccines work and they save lives. The vaccine might not prevent you from testing positive, but if you get vaccinated, it will protect you from severe illness, from hospitalization, death, and long COVID.